Good morning, Minister. And first of all, I just want to talk about the positives, the Autism Innovation Strategy and the National Access Plan, and welcome those and say that, I just want to see those, and I think we all want to see them proceed without delay. But the biggest issue that any of us, I think, are contacted about is the assessment of need and the lack of therapies. And speaking to the manager in one of the CNDTs, she said the majority of children being referred to her are children with suspected autism. And so I suppose the assessment is vital in order for the children not just to receive the diagnosis so that they get the proper school placement, but also that they get the proper follow-up services. And so I'm just asking you, because I know the CNDTs are a huge problem with recruitment and retention, so what measures have been taken, or do you expect the recruitment process to improve, in this year, or what measures are being taken to try and address those, because there is a huge problem there. And just also the need for cross-departmental cooperation between disability services and CAMHS and indeed education, because a lot of children, if they don't get the supports they need, or if they're in an inappropriate school placement, they develop anxiety and they need the mental health supports. But CAMHS do not seem to be addressing the needs in many cases, especially if the child is autistic. And that seems to be a problem. There just needs to be better cooperation, I think, between all of the teams, because I'm hearing from one side that they're not getting the information and cooperation from the other. And now I know there's a lot of other issues and the time is very limited, and I know public attitude is one of the things that needs to change as well. And just very quickly, there's another issue I raised with you before, is respite as well. Respite for children and their families. There's a severe lack. I know in my own area there's a severe lack, but also all over the country. Thank you.
Thank you very much, and thank you, Deputy, for the number of questions there. So you've asked me the question there in relation to recruitment. Absolutely, the current model isn't working. And it has to change, and that's why there would have been a meeting in the last 4 weeks where myself and Minister O'Gorman would have met with the national team from the HSE along with Paul Reid, and where we agreed that a roadmap would be put in place to ensure that we could actually attract more into it. So I'll give you some examples of what is in plan. Now, to say that this at the moment isn't finalised by any manner or means, because we said both sides would come, the department would come, the Department of Health, the Department of DCD, and also the HSE, and we would compile it together. It's approximately 4 weeks since we had that meeting. We had a meeting as well with the Taoiseach, along with Minister Foley, along with Minister Madigan, as well present on it. So the plan here is, what I'm saying is, first and foremost, within the HSE, they currently don't have any behavioural therapists as a pay grade. We are producing them, but we're not recruiting them. So that was one of the first asks, that they would put in place a pay structure for behavioural therapists. The second thing was, we didn't have any OTs, physio, speech and language therapists on the critical skills list. We've written to it, they're now on it. We also have a problem in recruiting from students who finish just up in college, as we have at the moment. They have to wait for CUR to come through and everything else like that. And we know the process along that. It's not time sensitive to our need. So what we have put a proposal forward is that we would recruit directly from colleges, and while in recruitment directly from colleges, we would put them in as an assistant level till their CUR application would come through. Minister Harris has announced extra allocation of posts, but we know that it'll take a while for that to come through, but it's good to have it in the mix. It's really welcome, the acknowledgement of the need for therapists. The other piece that we have added in there as well is in relation to if you were trained in the UK or trained abroad, that when you come home and you're missing a component of, that we actually recruit you in and meet the need of that component while training in service. And finally then, if we managed, and then we talk about returning of therapists to special schools, returning of therapists and validating for new schools, and also looking at therapists that, where am I going with this? Sorry, for a second, my train of thought got lost there for a second. It was the recruitment of return of therapists to special schools, the validation of therapists into new schools, and I talk about the likes of Rochestown, I talk about the likes of Carrigaline, there's a number of them here in Dublin as well, that they have no therapists on them, that they would be validated into it. And finally, the last piece that we need to do in relation to the whole recruitment is actually the training of the work experience for trainee therapists. At the moment, because we don't have a clinical proper number of people on our post, that 70% is what we have. We have a 30% gap in therapists on a lot of our teams, that in actual fact, if we could get that up to 90, that we could actually provide training on the job as well. That doesn't happen at the moment in any of the teams. It's critical that training therapists would get the opportunity to train on the teams as well. So that is in relation to the recruitment. In relation to CAMHS, I couldn't agree more with you. There does need to be that national access policy. National access policy has to work a number of ways. It has to actually work with integrated, interfaced into primary care, into mental health and into disabilities. And that actually at certain times the diagnosis, the need within the diagnosis might change. So if your preliminary diagnosis is autism, but actually you now need to be reassessed for ADHD, and that you need to have that integrated access. It cannot, integrated access needs to mean it's universal across all disciplines of it as well. And I only spoke to Minister Donnelly about that last week, and Minister Butler, that we need to have a better integrated access when it comes to autism and access to services on it. Respite in the Cavan-Monaghan area, yes, that is at the moment is under discussion, because in one of your counties children only get respite every second week. You do not have a designated respite house, so I'm discussing that with the local CHO manager at the moment as we speak.
Okay.